Now we have you as Mr. Yudhajit, and I was really impressed to see how well you've worked and researched towards ADHD, the way you've put on national level conference for the impact of COVID on mental health, and I am really excited to do a podcast. Let me give you a brief introduction about ourselves. I am Akriti Madan. I am the founder of MHP Mental Health Peace, and we are here to combine 11 aspects of psychology into one platform. Us is one of them. And this is Lavanya. She has her own NGO, and she is a 18-year-old student that gives me immense happiness to see how she's succeeding. She's one of our interns also. She's doing her bachelor's in DU, Delhi University.
I'm glad to be here as well. Thank you for having me.
So, Lavanya has a question for you.
Yes, so my first question for you is how do individuals with ADHD leverage their unique qualities to take
Mhm.
control of their lives and navigate beyond societal expectations?
That's a very good question, actually, and difficult one to answer, to be very honest. The thing that we need to understand is that every person with ADHD is different. So I am just one of millions of people with ADHD, but there are other people as well, and we are all different. And I know there's one thing that is often said about in the autistic community is that because you know an autistic person, you know one autistic person, you don't know the entire autistic community. The same holds for us. People, a lot of times we tend to be grouped together into one monolithic group of like ADHD people, but it could be further from the truth. We are all different people. We all have different qualities, but there are certain things that we kind of, most of us tend to share, or at least a lot of us, big number of us, is our tendency to be extremely creative. Like when I say creative, I'm talking about creative in terms of thinking solutions. Now, they might not be practical, yes, but creative, out of the box. We tend to be very huge, lot of information in our heads all the time because we tend to know little things about a lot of topics. So instead of knowing a lot of things about one topic, we know little things about a lot of topics, right? So out of the box, divergent thinking, information dumping is something that we're really good at. We're really good at finding our way through in situations which doesn't require a lot of structure. Right? A little structure, yes, but not a lot of structure because without structure, we'd not get any work done, most of us. So I believe it's important to find a place where these qualities can be rewarded and used, right? So if you're working in a group trying to solve a problem, one of the aspects of problem solving is, of course, brainstorming. Brainstorming requires coming up with solutions. Now, you don't have to consider the solutions practically, just come up with solutions, right? So, having a teammate who might be really good with divergent thinking, it could be a really huge blessing because you get a lot of solutions. Now, it's completely up to you how, whether you consider that, think about the pros and cons and everything, the cost benefit analysis and everything. But you need to start somewhere, right? And that's something people like us can contribute, something that we can really help with. We can really thrive in situations that require a lot of creativity. So instead of a boring desk job where you just sit at a computer throughout the day and do nothing, that will be very boring for a lot of us. But any place which requires a lot of creativity, divergent thinking, as I said again, these are the places where you can thrive as well. So oftentimes person who is comfortable with their ADHD, that's very important as well, being comfortable, because a lot of us are very ashamed of our conditions. We usually tend to thrive in creative spaces, for example, arts, theater, right, and all such places. Sports, of course, huge place where you can really thrive. So it's all about finding the niche where our strengths can be accommodated by non-ADHDers, non-neurotypicals, as people tend to say, don't like the term, but non-ADHDers.
Now, you were just talking about the fact that they have to go through a lot at the end of the day. So that concerns me that it is actually affecting them emotionally so much. They have to be emotionally, and it is with the therapist or the counselor's guidance that they gain. I wanted to ask, in terms of that emotional resilience, how do the ADHDers navigate and master their emotions to actually handle their life challenges?
That's a very good question. Very good question. I think it is something I can relate to as well. Now, ADHD, I think the name itself is a misnomer. So the problem is not really with attention, it's mostly with the entire executive function group. So you have attention, perception, regulation of attention, memory, working memory, of course, and emotional regulation as well, and planning and everything, all sort of attention, executive function basically. So our emotional regulation capacities tend to be, what shall I say, dysfunctional. I don't know if that's the right term, but there's an executive dysfunction overall, and that affects emotional regulation capacities as well. So people with ADHD tend to be very emotionally sensitive. We have very low threshold for emotion activation, something that a non-ADHD might feel nothing about. An ADHD can be completely overwhelmed by that particular situation because of their emotions. So that's a natural thing that we do tend to have. And that's one of the reasons why a lot of ADHDers also get diagnosed with emotional dysregulation, the disorders related to that. So it's very difficult for us to learn how to regulate emotions. Again, no one is born into this world knowing how to regulate their emotions. It's a completely learned skill, completely dependent on the kind of environment you get in your childhood. Parents, elders, other elders in the family, in an Indian setting, of course, peers, relatives, neighbors, the kind of environment they create for you. The thing is, with a lot of children who have ADHD while growing up, they don't find that situation. Of course, it's very difficult for a parent or a family to kind of be with a child with ADHD.
Right.
So we, all of us who have seen a child with ADHD, we know, right? So it's very difficult for them to also like understand and accept the child, because the child tends to be so all over the place, right? Usually, of course, not everyone, but usually. And of course, since ADHD tends to have a huge genetic basis, a lot of times the parents themselves might have undiagnosed ADHD, and their grandparents and other people in the family as well. So their emotional regulation strategies might be completely out of the window as well. So when you are growing up in a family where emotional regulation is not really talked about or not really practiced as such, you don't have a space to learn it as a child, right? The first place is family, the second is school. The less that is talked about, the better it is, right? We all know how a school system doesn't foster any important skills to our children. So you don't learn that anywhere either. So the only place you get to learn that is either your peers in college or in higher education or in therapy. Right now, when an ADHD goes to therapy with emotional dysregulation, they might not go with problems with attention, problems with other executive function. They might go with problems with emotional dysregulation. Now, they are oftentimes misdiagnosed with depression, bipolar, borderline personality disorder, because we still do not want to accept, at least in our country, that adults can have ADHD as well. A lot of times, doctors, therapists, they all believe that once the child grows up into an adult, the child grows out of ADHD, but that's not how it works for most people. People just learn to mask it, to just get on with their life without a lot of difficulties. So therapy, a proper diagnosis, or even a transdiagnostic approach, if therapist follows that, that's a place where they can actually learn that for the first time, that they might learn something like that. If they're lucky, they can also have peers who are regulated themselves very well, so they can learn it from them as well. Single co-regulation where one person regulates the other person.
So I have one question. Since you mentioned that all those who are like ADHDers, they generally have a lot of emotional conflicts as well, or there is emotional dysregulation. So how can we like actually recognize if they have the potential to be ADHD leaders or not, or do they have the leadership qualities as well?
I'm
Keep
sorry.
wondering because recently I watched a TED talk where the guy was talking about how psychopaths make great leaders. And I started to think about different kind of disorders, and I felt like how ADHD people are so creative. They might get distracted from one thing to another, but when they actually are working towards getting through it, probably from the concentration pills, which I keep thinking even I need them at some point, I feel like they might make great leaders. Do you have any opinion on it, or how do you think is that possible?
So when we talk about leaders, the idea that initially we have in mind authoritarian, product-oriented people, right? So, and that's why I said that psychopaths might be good leaders. And I'm sure there are a lot of psychopaths in a lot of organizational leadership as well. But leadership, that's one type of leadership. That's the most common type of leadership in corporates, but that's just one type of leadership. Leadership, there are a lot of different types of leadership as well, right? So one of the reasons, I think this is also related to this, one of the reasons women in the past, and even till now, a lot of places were not considered good enough for leadership positions because it was thought that they are not as ruthless as men are, or men should be in leaders, right? But now we know that leadership is not dependent on how ruthless you are, but how nurturant you can be as well, right? So what was considered to be the negative thing for women, they're nurturant, so they could not be ruthless in organizations, so they are not good leaders, is actually being shown as one good quality of leaders. We don't want to work under people who are ruthless. We want to work on people who are nurturant and caring, right? So it is not only up on women to be nurturant. Men can be nurturant as well, right? If they want to be, if they have the capacity to, right? It's the same thing with ADHDs. Distractibility is a thing. ADHDs tend to not be as ruthless. Again, I'm just talking in general. Everyone is different, right? We might not as ruthless, maybe, but nurturance, we know what it feels like to feel excluded in social situations. We know what it's like to be the weird one out or be the troublemakers in our classrooms or other settings. So we know that. We have an understanding of what it might be like for someone to feel excluded, for someone to be disparaged for whoever they are as a human being. So we know that. We have a more, I would believe, lived experience of what it is like to be excluded in those situations. We also can come up with a lot of ideas, they said. Leaders, what happens in a lot of corporates is that the employees do all the work, the leaders is like, they get the credit at the end of it, as they are the ones who led them. But then if you see, they're not leading them really. Like everything is kind of being done by themselves. So it's just because of the entire creative, divergent thinking part, I believe we can be good leaders in which requires a lot of different vision, a lot of different ideas, a lot of different, whatever is in situations which doesn't require, which requires you to not give up, right? Indefatigable, as this, the idea that whatever happens, I'll just go on with it. Now, that's something that I believe we are really good at. I'm not saying people who don't have ADHD can't be good at it, but I believe that's something that we can be good at. And the stereotype is that because of our distractibility and attention regulation issues, we are not good leaders. But then rarely do leaders work by themselves. Leaders always have advisors and other people to work with them, to advise them. So collaborative leadership, and I think one thing that everyone should read up on is this thing called the Indian model of leadership. It was devised by a couple of Indian researchers. I can't recall the name now. So seen that in our setting, in our cultural setting, the Western models don't work at all proper. I think we fit in more in the Indian model of leadership properly.
That's true. I actually read through it and it made so much sense to me. And all these laissez-faire and democratic, they might work out outside, but the cultural factor does count in. If I leave Indian people out there for a laissez-faire, my work is not going to get done.
So I have one question to ask, which I'm very curious to know, that what are the strategies do individuals with ADHD employ in their day-to-day lives?
Again, it depends on what they are particularly working on, what task they have in hand, and what are their problems in. As adults, most of us tend to be more inattentive than hyperactive. Most of our hyperactive basically goes on in our minds. So while a child with ADHD might be completely all over the place, we tend to be all over the place in our minds, not physically. So I believe one of the things that we really struggle with is time management. We have this thing called time where we tend to lose track of time very easily. So time management is something that I believe everyone of us works on in certain ways. Now, some people go to an extreme where they set out plans and plans and plans. So they make an entire routine for the entire day or the entire week, and they do not want to deviate from the routine, because they know if they deviate from the routine, they will be gone completely. The entire schedule will be put off. People tend to be a bit more calmer in that. They plan out the important parts and how much time they want to give to it, and then just go on with it. Personally, I don't plan out my tasks in advance because I get bored if I do that. So, and I do have time blindness. For me, sometimes time just flies, sometimes it just doesn't pass at all. So personally, I don't do anything about that. I just let it go. I'll just go with the flow. Another thing that we need to work on, most of us tend to struggle with, is interrupting people in conversation. So we always have things going on in our mind, right? When a person sitting in front of us, conversing with us, is talking about something, and we already know what they're going to talk about, right? So it makes no sense for us in our mind to sit through the conversation because we already know what they're going to say. So we just tend to come in and fill in for them. But they don't like it, of course. Even I won't like if someone interrupts me, right? So that's something we really tend to struggle with. Now that I'm on medications, it's much better. But I remember I used to apologize and tell in advance to my friends or other people I was conversing with that, this is the thing. And if I ever interrupt you, please know that I am sorry for doing that. I am really sorry. I'm struggling to not do it. But then I'm sorry. Sometimes it just comes out. I just blurt things out. So this is something that we do struggle with. And one strategy we use is this, to say it out in advance to people that, please bear with me like you'd bear with any other person with a neurological condition. Just bear with me. I just try, but sometimes I can't help. A lot of in corporates nowadays or in other workplaces, in professional world, a lot of people with ADHD, autism, and other development, they're using in a mail you can put down a footer, right, like saying that this is my condition, and if you find any errors in spellings or punctuations or any word here and there, just bear with me. Just understand that I didn't mean to do it. It just happened because I'm going too fast to spell check. So that's something people did do, but I think that's extremely brave, and I don't think that's going to work in society where if you say that you have ADHD, people are just think you're some weird person, whatnot. That's something that people do. I think relationships is something we do struggle with because, truth be told, a lot of people with ADHD tend to get bored in relationships, not only romantic relationships in general, because after a point there's no novelty in that, right? So I have personally heard this a lot, that you tend to treat people like commodities. I'm like, no, I don't treat people like commodities. I simply do not remember that people exist if I don't meet them for a long time. You don't have this thing called object permanence is completely out of the place for me. If I do not meet people for a long time, I completely forget they exist. But if you remind me that, okay, I'm like, oh yeah, that's fine. I know that person, definitely. So this is something we do struggle with a lot of times. I know a lot of people who have had terrible fights with their partners because forgot to text their partners for days because they've simply forgot they exist. So it's not voluntary, it just happens, right? It's just object permanence. So that's something we do struggle with. And sometimes I know to just make it a point to text them at least once so that they will have the notification on their phone and they'll know that, okay, this person exists. So they might not forget about them. So different strategies, all strategies, different strategies for different people.
Actually, when you mentioned that it's been better after medications, to break the stigma of people thinking that medications are totally addictive, medications are not good for you, you should choose therapy over medicines, and the fact that people don't realize how important it is to take both of them together.
Yeah, indeed. The thing is, ADHD medications, the first thing that people know is methylphenidate, so Adderall and stuff like that. Now, of course, that's usually the first line of treatment, but in India, that's very regulated. So, like in the US and the UK, now you're having this shortage of Ritalin, right? Methylphenidate. In India, we don't have a shortage because it's extremely regulated. So if you go to government hospitals, like I was treated in Nimhans, there you won't be prescribed methylphenidate at all. You will prescribe atomoxetine, which is a non-stimulant. It is a selective non-epinephrine reuptake inhibitor. So every dose you prescribe, every packet you sell, you have to put it down, and it's a lot of things, a lot of very regulated stuff. Now, yes, there is a potential for addiction. Yes, definitely. Now, if a non-ADHD is taking methylphenidate every day, like 5 to 6 pills, they'll get addicted to it, definitely. But for ADHDs, methylphenidate is not addictive for most of the people. It's people are worried that they might get addicted to it if they take methylphenidate. The thing is, most of us forget to take medicines. So you can't get addicted to something you're forgetting about, right? No, that's a strategy again. So personally, what I do is I have coupled my medication time with my mom's medication time. So I know that I have to give her medicine. Now I won't forget that. I might forget my own medicine. So when I give her medicine, I automatically remember to take my medicine as well. They coupled their cat's eating time with their medication time. So every time they feed their cat, they remember to take their medicine. So they won't forget feeding their cat. They might forget the medicines. That's one strategy we use. So you see how difficult it is for us to remember to take our medicines. So it's not addictive for most of us. Some people do have terrible reactions to it, but again, different people react to different things. But all medications, it's not only about psychiatric medications. I don't know why psychiatric medications have so much stigma attached to it. But any medications you take, they have certain sort of payoff, right? Certain sort of side effects. You take paracetamol for a long time, your liver is going to get affected. You take any kind of medicines for asthma, which I do because I also suffer from that. It's going to make you feel very terribly hungry throughout because of it's a steroid thing. So you're going to gain a lot of weight. So all sort of medications have some sort of side effect, but it's all about whether the effects outweigh the side effects. Now, for me, I believe my medications the effects of it outweigh the side effects. What are the side effects I had? Initially, there are a lot of rashes, a bit of different difficulties in eating. Initially, there's a bit of mood dysregulation where you tend to get depressed for a week or so initially after starting. But after that, your mood gets better. You tend to remember stuff better. You don't forget silly trivial things that you need to remember. So what used to happen with me, if I'd be sent to the shop to buy something and go to the shop and forget what I was supposed to buy, right? Now on medications, I don't forget. I might forget one out of the 6 things that I had to buy. But that's fine. At least I'm not forgetting all the things to buy, right? So you see very small differences that actually add up to make your life better. And yes, therapy is important because a lot of people want to learn time management. A lot of people want to learn more social skills. A lot of people want to learn how to navigate the life, the environmental changes that they need to bring. Personally, I tried all those things, didn't work out. I had undergone emotional regulation training, so I knew that. I had undergone DBT before that. What helped for me is working on my shame. So I always knew that I had a lot of potential, but I was always ashamed of never fulfilling those potentials. Now, therapy helped me with knowing that okay, this is just a difference in my brain. It doesn't make me a lesser being than other people. I might have potential, but most people do not fulfill their potential. So it's not only me, who is not fulfilling his potential. So therapy helps with that aspect. Medications can't help with those things. But if you're not on medications and if your ADHD is very severe, which I had, therapy is not going to help you. It's like having a broken bone, which is broken into pieces, and then you're trying to do physiotherapy on it. Physiotherapy is helpful. You can't recover from a broken bone without physiotherapy. But before that, you need to get a cast on. To get the bone back in shape. After that, only you can, go ahead about your physiotherapy and whatever stuff. Similar thing here. If your ADHD is so severe that it's affecting everything about your life, you can't go on about therapy and believe that everything's going to get good. I know a lot of this ADHD coaches on social media, Instagram, LinkedIn, who are like, you take cold showers and ADHD will be fine and stuff like that. So one person reached out saying they had heard from it that closing your one eye reduces ADHD symptoms. And I was like, if that was true, then people blind in one would not have ADHD,
I
right?
think we might have to do one more podcast on the scams going on in psychology sector.
But I always encourage people that, if you believe that your life is so bad that you want to take medications, go on. Why is it bad? People are taking medications for blood pressure, diabetes, cholesterol. That's not bad. So why should this be bad? It's the same chronic issue. It's a chronic issue as well. So why is it bad? Right. So I do my bit to help people out to dispel the myths and the stigma.
Sir, I have another question. Since you mentioned that ADHDers have a lot of problems with their relationships as well. So, how does family members play a role? Like, is the support very much necessary, or is there acceptance like their child is having such an issue? And do they actually accept that their child is having ADHD and they support therapies and medications or not?
Okay, so when I was growing up, we never had an idea that there's anything called ADHD. So throughout my school life, it always used to be complained that I'm a very bright student, but very talkative, never pays attention in class, always staring outside the window and stuff like that. Now, when I look back, everything falls in place. But back then, no one knew called ADHD. So for us now, when you're adults, when we share it with our parents, I don't know, some people accept. My mom was like, okay, fine, what do you want to do about it? But a lot of people might like, no, how could you have it? But for us it doesn't really matter at this point. But now with so much awareness, I don't know if it's awareness or more information bombing on social media, parents know that this thing exists. ADHD, something called ADHD exists. Some enlightened parents want to get their child checked and diagnosed if there is. Most parents don't want to accept that their child might not be normal, quote unquote normal child. It's still difficult to convey that to a parent that your child might have these difficulties. What I tend to prefer now, of course I don't work with children, but sometimes I do hear stuff from parents, and some parents just want me to give some idea about what their child may be going through, or anyone I know personally. I always tell them that your child is different. When I mean different, I don't mean abnormal. I mean your child has different needs. Every child has different needs, right? Now, when a child is wearing glasses, let's say, now when I was young, that was very rare. I was the only guy in my class with glasses. But now almost every children is wearing glasses, right? So when a child is wearing glasses, you don't make the child forcibly sit at the back. you go and tell the school to make the child sit in the front so that the child can see the board. It's the same thing with the child with special needs. If a child has ADHD, the child might need special needs. The child has autism, the child might need special help. And that's perfectly all right. Every child is different. That's what I always want to convey to people, that every child is different. Every child has special needs. We just don't recognize them. Some children just need it more than others. That's it. It's all about it. So I think how we tell this stuff to parents matters when it comes to spreading awareness. And that's why I said I think social media is more about information bombing than actual awareness. There's no nuance, there's no attempt to make it more relatable to people. If you go and tell a child that your child has brain damage and that brain damage is called ADHD, no parent is going to get the child screened for that. No one wants to hear that the child is broken or anything like that. But if you emphasize that the child has certain needs which are different from other people, but otherwise the child is perfectly like any other child, that makes it more acceptable to parents, right? So the nuance is what's missing. So very little awareness, I would say.
Actually, I was hoping to ask you about any unique case that you've faced till now. And being from a psychology background, I know you have to keep their names and everything private. But now I feel like your journey in itself is so, so inspiring.
Thank you.
Just example that you gave us today.
I'm glad. I really find it very difficult to accept that it might be inspiring, but I heard it, so I'm kind of like I need to accept that. Okay, it might be inspiring to people. I can't help with that. But yeah, I do. As I said, I don't work with children. I do work with adults who might be navigating this with ADHD. So my work mostly solely focuses on that, on to help them accept themselves and to decondition them from all the shame, humiliation, all the negative things they've told themselves about themselves. So it's sad, but there's a good thing. There's light at the end of the tunnel when you finish your work.
Another thing that I wanted to bring out about you is that I keep seeing that you try to break stigmas here and there. And the biggest stigma that you've broken is men in psychology. I just, there's a whole fight for feminism, patriarchal society, this and that. But I feel so sad when people say that it's a job of a woman. For example, we watch sitcoms and they say a male nanny. That's so weird. That is not acceptable. A male nurse, that is not acceptable. And similarly, a male psychologist, not acceptable. But now that I actually see how you work with your clients, with yourself, because our journey to learn never ends, and how you keep breaking stigma, that's what makes me want to know more.
So when I went to study psychology, I am the first person in my entire family, extended family, to study the subject. No one has ever studied the subject. So I had no one to guide me. I was inspired by one psychiatrist whom I once met, and that's how I decided to study. But I wanted to study psychiatry initially, but then I came into this field. I had no idea what it is about. When in my bachelor's class, there were 77 women and 11 men, including me. So 7:1 ratio, So it's a very, very skewed ratio. If you plot it, it'll be like completely drastic. I don't know what skew it will be, but it will be very difficult to see even, I'm pretty sure. So after COVID, I've seen more men take it up, which I think is good. But then there are a lot of random places which offer psychology nowadays. So I don't know the quality of people they're producing. But it's a good thing, I think, men taking it up. I don't believe there's any reason why men cannot be in a caring profession. I mean, medicine is a caring profession. So there are more men in medicine than there are women. And of course, there's a different reason for that, because women do tend to find it difficult to make a career out of it. Not because of women's any inherent deficiencies, but because the structure is like that, where women just find it difficult to find themselves in, proper any other place where women find themselves in a bad place. So there's no reason why men cannot be in this field. Men can be as nurturing and caring. Who do we learn about therapy? Who's the basic therapy is built on Rogers. Rogers is perhaps the most beautiful person to read about, right? Rollo, very beautiful person to read about. These are not women who did this. These are all men. The first man we think about is Sigmund Freud. That's a different thing. But then therapy itself is based on Rogers, founder of clinical psychology, Leitner Whitmer, very, very nice person, nurturant, caring human being. So there's no reason why we cannot be like Rogers or Erickson or Bandura or Beck or other people like this. They're all very nice, nurturing, caring, loving, nice people to be around, what I've heard from people or I've read about them. So there's no reason why we cannot be that. if we want to be in this field, we can be. Now, of course, there is a more financial prospect that comes with it, which dissuades a lot of men from going to the field, because still we are not at a place where men can say that I do not want to be the breadwinner of the house. We are not at a place where we can say that. So considering how difficult it is to make a career out of it, how long it takes for us to make a career out of it as a therapist in this field, that's what leads to a lot of dropping out. Because let's say a lot of people qualifying getting a job as assistant professor or professor is not easy, right? So a lot of people do not have the time to invest in that. They just want to get done with masters or bachelors and then go into a field where they can earn, because they are the ones who have to supply for it. Now, I'm definitely not saying it's easier for women, because I know a lot of women are also breadwinners of their houses nowadays. There's no difference between a man earning the majority of the income in the family and a woman doing it. But still, there is at least some safety net for women in this therapeutic profession. I'm trying to be as diplomatic as possible, but I'm just saying, the expectation on a man to to carry the financial burden is much higher. And as much as we talk about men breaking the stigma and stereotypes and everything, we internalize these things. A lot of us do. We internalize these things. So that kind of pushes a lot of us towards academics. So if you go to academics, you might find men in positions of HOD and other decision making positions, right? So because that is more well paid than therapy as a profession, and that is less emotionally charged profession than therapy is. So a lot of men do not want to face their own demons that's within them. And one thing of therapy, what I personally believe in, is we need to face our own demons before we start off, or while you're working. A lot of men do not want to do it, not because they don't want to get better or face themselves or make them better human beings, but it's so scary for people to do that, right? And it's so difficult for us men especially to be that vulnerable in front of a person. It's so difficult for a man to accept that, okay, I can provide for someone emotionally as well. It doesn't always have to be financially, right? Men do provide emotionally, but that's mostly for people related to them. To accept that I can sit with a complete stranger and provide for them emotionally, I can feel sad for them, I can cry with them if I want to. It's a different thing altogether. Very, very difficult prospect. I wish it was more acceptable for men to take therapy. I wish the entire narrative was that men bad was not men bad, but men can also get good or get become better human beings. I wish there were people who would be more open to facilitating space for men. I don't mean women only. I believe it's on us to facilitate space for men to start the journey of becoming better and better every day. Lack of spaces like this is what created demons like Andrew Tate, who prey on vulnerable young men who are struggling with their self-worth and self-issues. And instead of a good nurturing space, they find horrible people like Andrew Tate who just scam these people off for his own benefits. So I believe somewhere we need to start. And once we men become more accepting of ourselves, that's where we can see more men in this profession, like you see in the US, perhaps.
I'm so sorry that I'm taking so much of your time today.
No, it's
But
all
now
right.
that you've mentioned about Rogers and Freud and so many more people who are the backbone of psychology, I would say, and we are discussing about ADHD, I wanted to know what is happening in the practical field. How relevant is CBT? Because every other practitioner wants to say CBT is the best thing for everything. And the students keep on thinking that, you know what, it's a temporary solution to bring the client back again and again. And how are you using these theories practically? Are you following only psychodynamic, or you're mixing and matching some of the humanistic perspective, some of the positive psychology perspective? How's it going on?
Okay, so currently what we see is a lot of debate about, as you said, about CBT, a lot of debate about ADHD, the nature of it. There's a very small group which believe everything is a trauma response. ADHD is also a trauma response, but there's no evidence to show that, to be very honest. So now CBT is very important. For example, time management, social skills training, all this is CBT. What I see is CBT, as it was originally conceptualized by Beck, has evolved in a lot of different ways. Now, students are taught CBT because that's the easiest thing to teach, to be very honest. Teaching psychodynamic or teaching any mindfulness-based technique, it takes a lot of time to teach. CBT is the easiest thing to do in an outpatient service. It's the easiest thing to teach as well. But I find a lot of people not knowing what CBT actually is. So CBT is not gaslighting yourself. It's not denying your emotions. It's not saying that I am the problem. It's not internalizing all structural issues or systematic issues. It's not none of these things. Yes, CBT doesn't overtly talk about emotions. CBT doesn't solve systemic issues. But CBT was never supposed to solve systemic issues. No therapy is designed to solve systemic issues because therapy is not designed for that. It's like saying, oh, taking a paracetamol will not fix your broken bones. It's not supposed to fix your broken bone, right? So CBT is practiced terribly by a lot of people, and that makes the client coming back again and again because it was not done properly ever to them. A good, well done CBT can the client for years. Now, client coming back can be because a lot of issues. Just because someone is saying psychodynamic is good and CBT is not, and doesn't mean a client undergoing psychodynamic will not come back to therapy. A lot of people just want to come to therapy because they want to talk about their life. You can't say that client has relapsed and they've come back because of that, right? So I believe CBT is a good tool to use in a limited manner. Now you can't CBT everything. You can't solve trauma through CBT only. Trauma requires a lot of mind somatic based approaches, a lot of mentalization based approaches, and a lot of stuff. You can't do CBT with, let's say, bipolar or borderline personality disorder or any personality disorder per se. And that's why it has evolved a lot of things. What I see as CBT is helpful in ADHD in a lot of things, especially the behavioral part of it. So time management, social skills training, routine making, changes and everything. But the more inner things, for example, the shame, the guilt, the negative self-talk associated with it, I personally found that ACT works very good with it. And I work from an ACT perspective. My work is very much based on ACT. If you have read ACT, you will realize that it's basically existentialism, humanism, behavioral analysis, based approaches, and Buddhist philosophies combined into one. So it has a mix of everything in a one package. So I ACT because of the acceptance part, because it has so much emphasis on acceptance. I believe that thing really makes it easier for us to accept ourselves that, okay, I have this condition. I can't do anything about this condition per se. I can't take my brain out and exchange it for any other brain. I wouldn't really want to do that either. It's the acceptance that, okay, I am whatever I am, but I can still work on myself. I can still work to achieve what I want to achieve. I believe that's the best conceptualization. Now that I work on what I want to achieve comes from existentialism. I believe this is what's the best thing to do. I don't know how useful psychodynamic can be for ADHD because I don't see it, but it could be. I'm not saying it cannot, it could be. But I personally believe ACT is something that works magically with ADHD. All we need is to keep the focus on the topic and not get deviated continuously here and there. But if done well, ACT plus CBT works really, really good. Really, really, really good. And you put in emotional regulation part of DBT there as well to help with emotional regulation and interpersonal relationship. Perfect. You have a very good mix of it. I am kind of now trying to find one thing with it, but still it's in working phase. So let's see. Maybe years down the line.
We'll have one therapy only by Mr. Yudhajit.
Too far to think about it now.
But it was really amazing talking to you. I think Lavanya also learned a lot today.
Yeah, I learned a lot, and the way you beautifully explained your own journey as well, comparing to general audience, it was something very inspiring.
And I really like how you are just in first year and doing something like this. I think when I sit here now and I look back, I wish I had so many opportunities to do it back then. Pre-COVID and post-COVID has been so different in a lot of ways, right? So it's really good to see you here, and I'm glad that I could provide you with some insights and some learning. But I am very happy to see you here as well. And thank you so much, Apriti, for having me here, for inviting me, for extending that invitation, because it was really, really good talking to you. And I always feel like I'm talking a lot, but when I see someone being enthusiastic hearing, I find it really, really nice. It's really encouraging to have someone like you host me here today. Thank you so much.
Thank you.